Welcome to Scottsdale Center for the Performing Arts, Virginia G. Piper Theater. Please take a moment to silence and put away all cell phones and other electronic devices so you may enjoy the event without interruption. And now, sit back and relax. The event is about to begin.
Good morning. I'm Dr. Ann Lee Birch, Dean of the Arizona School of Health Sciences. It is my honor to introduce the stage party. Please do hold your applause to the end. Starting on my right, Dr. Norman Gevitz, Senior Vice President of Academic Affairs for A.T. Still University. And on my left, today's keynote speaker, Dr. Bert Simon, Associate Director and Professor, Doctor of Medical Sciences, and Director of Advanced Physician Assistant Studies at A.T. Still University, Arizona School of Health Sciences. And Dr. Michelle DeBase, Chair and Professor, Department of Physician Assistant Studies. Would any graduates, guests, or faculty who are current or retired members of the uniformed services or first responders please stand and be recognized? Thank you for all you do for our communities and country, and please be seated. I would also like to recognize friends and family in the audience who have supported the graduates on the journey. Please give them all a round of applause. I would also like to recognize Dr. DeBase and the PA faculty for their continued commitment to excellence in teaching, scholarship, and service. Graduating class of 2021. Today I stand with the Arizona School of Health Sciences PA faculty and staff in celebration of you. Master of Science in Physician Assistant Studies, class of 2021. We celebrate your accomplishments today with you and your loved ones. What a year this has been, year and a half really, filled with trials and tribulation, loss and grieving for many, and a renewed sense of hope as we look toward continued vaccine distribution. There is a reason that all over the country, in small towns and in cities, people stood in their doorways to applaud healthcare professionals like you, who were and continue to care for patients with COVID-19 in our hospitals, community health centers, skilled nursing facilities, emergency rooms, and urgent care units. I would like to suggest to you all that you are quite possibly entering one of the most vibrant, exhilarating times of your life, where your skills and humanity have never been more needed in communities across the country. We celebrate your graduation from ATSU today as you exemplify all that we believe in: whole person healthcare, commitment to the underserved, educational excellence, and community. All of you arrived here with vastly different trajectories as your stories. Your diversity enriched our learning culture and is central to the effectiveness of care in our communities. Graduating class of 2021, you will take this new knowledge, skill, professionalism, and this steady commitment to compassion and integrity and make a difference in the lives of so many. Continue to develop the resiliency you relied on over the past 2 years, tap into your unique strengths, and look for new challenges. Each day you have the chance to improve and even save the lives of individuals as you look to bring health to our communities in need. Patients will remember you, not only for the depth of knowledge and clinical acumen, but for your compassionate spirit, kindness, and the magnitude of your souls. Know that your profession throughout your lifetime is a gift to be opened and reopened and to be cherished. Continue your engagement and lifelong learning, and know your capacity today is a vessel half filled, ready and waiting to accept new ideas, new technology, that next piece of evidence or research that resonates for you. The spirit of innovation is alive and well at ATSU. Carry it with you. Leave yourself enough time for reflection, unplug, and let your imagination breathe as you think through the course of your day. As you approach each patient, the child, the athlete, the mother, the grandfather, look for the individual, the whole person, and make the connection that is so central to one person healing another. Each choice you make as a health professional not only shapes someone else's life, but contributes to the person you are and want to become. Finally, congratulations once again, and all my best as you continue on your life journey as a PA. It is now my honor to present this morning's commencement speaker, Dr. Bert Simon. Dr. Simon is former chair and current professor in ATSU's Department of Physician Assistant Studies. Previously, he served as vice dean at ATSU's School of Osteopathic Medicine in Arizona. Over the course of 37 years, Dr. Simon served as chair of physician assistant study departments at 3 universities, St. Francis University, Baylor College of Medicine, and most recently, ATSU. During his years as chair at St. Francis University, the PA program was the only non-medical school-based program ranked in the top 10 PA programs in the United States by U.S. News and World Report. In his years of clinical practice, he worked in occupational medicine at Volkswagen of America's assembly plant in New Stanton, Pennsylvania, and at Van Zant's VA Medical Center in Altoona, Pennsylvania. He also worked in the Coalport Area Community Health Center. Being politically active in the physician assistant profession, Dr. Simon served in a number of national leadership positions, including president of the Association of Physician Assistant Programs, and authored the annual report on physician assistant educational programs in the United States. While president of the Association of Physician Assistant Programs, he founded the Leadership Training Institute as a vehicle to provide needed education to individuals entering PA education. Dr. Simon has served as an educational consultant to more than 25 PA programs across the United States and as co-editor of Appleton and Lang's Q&A for the Physician Assistant, one of the best-selling board review books for PAs in the nation. With an interest in continuous quality improvement, Dr. Simon trained as a Malcolm Baldrige National Quality Award examiner for the U.S. Department of Labor. For his innovative approaches to quality management and educational program, Dr. Simon was featured in the book On Cue, Causing Quality in Higher Education by Daniel Seymour. Please give a big welcome with me in welcoming this morning's commencement speaker, Dr. Bert Simon.
Dr. Gevitz, Dr. Birch, Dr. DeBase, valued colleagues, and of course, graduates. Thank you for the invitation to share in this special day. Graduations are very special. I get caught up in everything, and we get to wear these spiffy hats. My wife made me take it off at dinner last night. We were in a restaurant. That might have something to do with it. As a faculty member, I've participated in graduation ceremonies since 1980. It's a lot of graduation speeches. I don't remember many of them, but I do remember some of them were very long. Don't worry. Graduation speakers most often have a cachet of celebrity, or they're individuals with significant intellects. I'm not a celebrity, and at best, I have an average intellect. I'll prove that to you over the next few minutes. I'm just a regular guy, member of the hoi polloi, and thus I bring a simple message today. I'm here as a messenger for humanism. To illustrate this message, I'll reference a video, a movie, a piece of fruit, and a book. I want this to illustrate compassion, learning, and hope. But first, graduates, please take a second to pat yourself on the back. Go ahead. You've chosen an incredible profession. Sitting where you are at PA graduation in the 1970s, I remember saying to myself, this is all very nice, but will I be able to get a job? The profession has grown to a point that would have been difficult to imagine in the 1970s. You've done very well by entering it. The profession will provide you with opportunities to help people, to be secure by making a good living, and to always have pathways of growth. Modern medical care is technologically sophisticated and quite amazing in what patients can benefit from in terms of emerging treatments. Miracle pharmacologic agents, telemedicine, minimally invasive surgery, patients in the United States can expect the most sophisticated care. But can they always expect the most humanistic, whole-person health care? I think we can do better. Allow me to provide some examples to illustrate this point. I refer you to a TED Talk featuring Dr. Abraham Verghese, an infectious disease physician from Stanford, entitled The Doctor's Touch. In this video, Dr. Verghese mentions how medicine has changed from the old days, how the emphasis on the history and physical examination has declined. The doctor points out the importance of listening to the patient and the laying on of hands as an important ritual that builds trust between the provider and the patient. He jokes that today if a patient comes into the emergency room missing a limb, no one would believe it until they get a CAT scan or an MRI. He laments how when he was in training, physicians and students would gather at the patient's bedside for rounds, and how in modern times, rounds largely happen in a room removed from the patient where everyone gathers to look at MRIs and the results of lab tests on the computer. He goes on to say that the patient in the bed has become an icon for the real patient that exists in the computer, coining the phrase, the eye patient. I would hazard that each of you either have used or will use a computer in performing patient care. Many of you will have it in the room with you while you're with the patient. As a patient, I have witnessed how distracting it can be when the healthcare person I'm dealing with is on the computer while talking to me, sometimes leaving me to just sit there as they type. I want to say, hey, I'm over here. It makes me wonder if they're inputting information about me or are they shopping for shoes? The computer is a great adjunct, but it is also a barrier between you and the patient. Add in the mask and the gloves that are worn in each patient encounter, and now you have several barriers between you and the patient. These are all dehumanizing factors that work against the therapeutic relationship, against being humanistic. Please don't misunderstand. I'm not a Luddite. I'm not advocating against using computers or personal protective equipment, but I'm pointing out that these elements make it more challenging for you as a provider to build that therapeutic relationship that's the basis for whole person care. Overcoming these barriers is a distinct skill set to refine and put into practice to be an effective clinician. In the 1940s, there was a popular series of movies centered on a young intern named Dr. Kildare. Dr. Kildare was based in a big city hospital, and the films highlighted Kildare's journey as he learned the practice of medicine, and he's taken under the wing by an experienced physician named Dr. Gillespie, and Gillespie becomes Kildare's mentor. Gillespie guides Kildare through a number of professional crises in the series of 10 films. In one of the films, Kildare is struggling to take care of a patient who is not responding to treatment as he thinks she should. Gillespie takes Kildare aside and tells him, medicine is not all guinea pigs and microscopes. Remember, this is the 1940s. Gillespie says, many patients have invisible wounds that only a doctor with a heart can see. He asks Kildare to go back into the room and listen to the patient to really understand what's going on. What a great endorsement of humanism. In the same vein, Dr. Verghese points out that it's important to understand patients often experience a spiritual violation that is associated with a more obvious physical injury. For example, when a person with a fractured humerus has, in addition to their obvious pain and limitation of the injury, they ask themselves, why is this happening to me? How's it going to affect my livelihood? There's all types of questions. Verghese contends that injuries are composed of both a physical violation as well as a spiritual violation, and it's important for healthcare providers to recognize and tend to all aspects in an attempt to heal the patient. These concepts should remind you of one of the foundational tenets of this institution, caring for the whole patient, body, mind, and spirit. This is the type of patient care that connects with people on a humanistic level. This is the type of care that promotes healing. I would always tell PA applicants that healing is different and separate from treatment. It's my conviction that one can be treated correctly from a technical standpoint, but not have much healing if the treating individual do not provide whole person care. Just as I believe that healing can occur in the absence of cure. For example, in caring for a patient with a terminal illness, much healing can occur as we continue to support and attend to the patient's needs. This in the absence of cure. So a cure is not always the end game, but healing always should be. Allow me to provide a simple illustration of a technically correct care versus whole person care. A few months ago, my cardiologist recommended I have a cardiac stress test. I arrived at the hospital, was checked in, and escorted to the waiting area. Then I was taken to the procedure lab. I was informed by one of the nurses that a cardiologist would be in attendance during the procedure. As I was being prepared, the nurses made polite conversation, and then two additional people came into the lab. Both had scrubs on, and neither introduced themselves. One of the two individuals gave me the injection to actually induce the stress element to the test, and then exited the room. The other gentleman sat in the far corner and began looking at other medical records on the computer. So by process of elimination, I concluded that gentleman was the cardiologist. During the test, he concentrated on his computer work, and then at the conclusion of the test, one of the nurses handed the cardiologist an EKG printout for me, and he sort of shrugged his shoulders, stood up and looked in my direction and said, "Well, we can't tell a whole lot from the EKG, we'll have to wait for the images." And then he left the room. The nurses were taking off my EKG leads and telling me to put my shirt on. When I asked, "Will someone call me with the results?" the nurse looked at me and said, "Oh no, you don't want anyone to call you. No news is good news." What an interesting perspective. I just had a somewhat invasive, expensive procedure that would determine if I needed an even more invasive procedure, and the system's built so it's better if no one communicates with me to tell me I'm okay. I found this troubling. The hospital I attended in this example was spotless. The equipment was high-tech. Everyone I interacted with seemed very competent. The care was professional, but not very fulfilling. I spent the next 2 weeks sitting by the phone wondering, how long is it going to take them to call me if there's something wrong? Did they lose my phone number? And I don't normally answer phone calls from numbers that I don't recognize, but I answered every phone call in those 2 weeks. And yes, you guessed it, they were all from telemarketers. That was a much more stressful experience than the whole procedure was. So this is a simplistic example of how good technical care was not a very healing experience for the patient, in this case me. Humanistic care does not require expensive machines, it's cost-effective, and it has no side effects. So why don't we do it more often? Now, ladies and gentlemen, I give you the banana. I've been eating bananas for some time now. And when I begin to peel a banana, I hold it thusly and peel the banana. Well, then I learned gorillas, who most of us would agree are probably experts in eating bananas. I learned that gorillas peel their bananas this way. This is actually the top of the banana. So the point here is that we should all be attentive to learning new and better ways to doing things. We should be tuned in to trying to improve what we do. As I mentioned earlier, I encourage you to work on your therapeutic relationship skills with the same zeal that you apply to learn the latest medications and procedures. Don't discount this element as an important aspect of your therapeutic armamentarium to promote true healing. My final example is a book entitled The Anatomy of Hope by Jerome Groopman. I often recommend it to incoming PA students that they read this book as an excellent aperitif before starting the PA program. But it also carries a powerful message for experienced providers. When I first encountered the book, it struck me as ironic that Dr. Groopman, who is an oncologist, should write a book about hope. Hope is not always the image conjured up when one thinks about an oncologist. But Groopman makes a compelling case that through his experience as a medical student, resident, and practicing oncologist, of how people triumph in the face of adversity, sometimes triumphing even when they may not survive. This book documents his discoveries of how hope can positively affect the course of illness. Groopman characterizes hope as the very heart of healing. Throughout this book, Groopman's primary message is a simple one. Patients should be able to count on us as healthcare providers to always provide hope and to always be there for them. Because if they cannot count on us, where else could they turn? So congratulations. I wish you much fulfillment and success in your PA careers, and I hope I see you all in the Doctor of Medical Science program. Thank you.
Thank you, Dr. Simon. Physician assistants are nationally certified healthcare professionals and state licensed medical professionals. Physician assistants practice medicine on healthcare teams with physicians and other providers. Physician assistants conduct physical exams, diagnose and treat illnesses and injuries, order and interpret tests, counsel on preventive health care, assist in surgery, and prescribe medications. Physician assistants practices may include education, research, and administrative services. Presenting candidates for the Master of Science in Physician Assistant Studies graduating class of 2021 is Dr. Michelle DeBase. Dr. Gevitz, the candidates for the Master of Science in Physician Assistant Studies have successfully completed the requirements for their degree. Upon recommendation of the faculty and program director, I have the pleasure of presenting them to you at this time. Would the candidates for the Master of Science in Physician Assistant Studies, class of 2021, please rise and proceed to the stage.
Baker. Megan Bausch. Madison Boston. Zachary Call. Adriella Cano. Carmen Chow. Michaela Chavez. Jeffrey Cronin. Casey Curtin. Walter Del Pinal. James Delaney. Austin Dykes. Sierra Drake. Ashley Eberson. Kelsey Enlow. Alyssa Estelle. Colleen Fay. McKenna Foote. Catherine Freeman. Samantha Jo Gallo. Tess George. Rosie Goose. Almadina Hyrich Ali Hozic. Liridona Halili. Lucinda Henry. Parker Hildebrand. Gabriella Asinia. Russell Jackson. Jasleen Cower. Brian Kennedy. Tracy Kennelly. Jessica Laughlin. Angela Lee. Bianca Leong. Julie Lynn. Natalia Mahoney. Courtney Marsh. Whoopi Massacoy. Matthew McElroy. Isabel Mike. Alicia Moen. Shannon Murphy. Diana Nguyen. Madison Odom. Nicole Otero. Edgar Padilla. Jocelyn Palomo. Deepak Paudel. Minerva Puchilin. Stephanie Kitavis. Casey Redmond. Kylie Richardson. Heidi Rumler. Anna Simler. Nicole Safer. Ramses Sanchez, Jr. Tierra Sanders. Carmen Slattery. Holly Stewart. Abby Sugahara. Alyssa Waitkus. Lauren Weedman. Adrian Wolf. In addition to those graduates present at today's ceremony, we would like to recognize those physician assistant studies graduates participating virtually. Holly Adams, Taylor Brickner French, Kathleen Callahan, Maya Johnson, Maria Nikoleva, Colby Pankratz, Tara Peterson, Leah Zampini, and Leo Carpenter.
Will the Master of Science and Physician Assistant Studies graduates please stand for conferring of degrees? On recommendation of the faculty and dean, I hereby confer upon each of you the degree Master of Science and Physician Assistant Studies with all the rights, honors, privileges, and responsibilities pertaining thereto. Congratulations.
Let's give our graduates one more round of applause. At this time, I welcome Dr. Gevitz to the podium for his closing remarks.
Graduates, I want to congratulate each of you, your families and friends. What a great accomplishment. Many years of hard work and dedication went into what culminates today as your opportunity to move forward. I'd like to induct you collectively and individually into the ATSU Alumni Association. You will never be far from the university, and chances are, wherever you work, you will be around other AT Still University graduates. Faculty and staff, thank you for your dedication to provide a quality education to these graduates. Dr. Birch, thank you for your help and leadership. Graduates, today is a very special day in your personal and professional life. The degree you just received is not just a credential. It is a testament to your proficiency and competency in mastering a range of difficult subjects. Congratulations we are proud of you. Your faculty and administration wish you the best, and we look forward to hearing from you as you go forward to improve the lives of your communities. Music, please.